So the title of my talk today is Observational and Electrophysiological Assessments of Temperament in Infants at Risk for Autism Spectrum Disorders. I'm working with Dr. Sarah Jane Webb at the University of Washington. And the purpose of the project is to look at early temperament characteristics in autism. So we know that infant siblings of children with autism have a 2 to 50-fold increase in risk for developing ASD. These are termed high-risk infants based on their genetic risk for developing autism. And we know that infants who later develop ASD may exhibit subtle temperament disruptions in the first year of life. So parents have retrospectively reported that infants have difficulties with self-regulation, display and higher negative emotional reactivity in the first year of life. And recent prospective studies of infant siblings of children with autism have shown higher levels of passivity and decreased activity at 6 months of age, and atypical reactivity at 12 months of age for those children who later go on to develop autism. So what do you know about temperament in autism? We know that parents report lower ratings of adaptability, soothability, self-regulation skills, effort for control, and positive affect in many children. And we know that also parent-reported difficulty predicts social engagement and responsiveness in these children. So it may be that individual variation in temperament can inform the behavior variability that we often see in ASD. So what are the common ways that we measure temperament? So most of the studies in the literature are limited to parent report studies, so only looking at parent report measures. However, we know that parent report may be subject to bias, especially contrast effects, and this may be relevant for children with autism, since parents may compare their infant sibling with autism to their older child who has a diagnosis. And we know that there's only modest to moderate convergence between parent and report and observational assessment of measurement of temperament in the typically developing literature. So recent studies looking at electrophysiological measures of temperament have examined patterns of resting frontal EEG, and that found that these individual differences reflect affective styles in infants. So Fox and colleagues have posited that left frontal asymmetry reflects more easy temperaments in children, while right frontal asymmetry can reflect more negative styles of temperament. And a study by Sutton and colleagues have found that left frontal asymmetry in high-functioning individuals with autism has been associated with fewer social problems, more cognitive flexibility, and more social awareness in these individuals. So our current project will be looking at a multimodal assessment of temperament in high-risk infants for ASD. So we'll be prospectively following up high-risk infants from 6 to 12 months of age, examining both parent report by the IBQR, an observational measure in the lab, an electrophysiological measure of temperament. And so this will be the first study to examine both parent and observation measures of temperament, and also examine a new novel EEG measure to examine a possible biological marker of temperament. So our first aim is to look at both parent and observational measures of temperament. So we'll look to determine if high-risk infants differ from low-risk infants who do not have an older child with autism, an older sibling with autism, on both parent and observational measures of temperament at 6 and 12 months of age. And we'll attempt to replicate findings of early temperamental differences in parent report at 12 months of age. And in doing so, we'll examine the convergence between these methods, both parent and observational methods, and look at the stability of temperament from 6 to 12 months of age. Our second aim is to look at an electrophysiological assessment of temperament. So again, we'll be looking at a pattern of resting frontal electrophysiological activity, which can reflect both approach and withdrawal behaviors and affective styles in infants. So we'll examine this in high-risk infants for ASD, both at 6 and 12 months of age. And we'll also examine the relationship between parent report and observational measures and this EEG measure. Finally, our last aim will be to examine temperament and risk symptoms of ASD. So we'll look to determine if temperament measured by parent report, observational, and EEG measures are related to early ASD risk symptoms in the first year of life. Specifically, we'll look at specific temperamental characteristics that have been known to be found in early development of ASD, such as activity level, decreased activity level, more negative affect and decreased positive affect, and less approach behaviors, and look at that association with symptom severity at 12 months of age. And we'll also examine the stability of these temperament measures and the association with their symptom severity at 12 months of age. So, potential contributions to the field. We'll use multiple methods to measure temperament across the first year of life when these early symptoms of ASD are emerging, so we can get a better sense of what is occurring in the phenotype at that time. And we'll also understand better understanding of parent and observational measure convergence. So how well do parent measures of temperament map onto our own observations of temperament in these infants? And finally, we'll look at EEG as a potential earlier indicator of ASD as a possible direction for investigation for biomarkers of autism. So in conclusion, temperament may be a promising factor for identifying early symptoms in ASD. It can aid in the understanding and the development of early ASD symptoms and the heterogeneity that we see. And it can potentially inform early interventions by targeting specific characteristics related to the clinical outcomes for individuals with ASD. So I just want to thank the Autism Science Foundation for this wonderful opportunity. My mentor is Sarah Jane Webb, my advisor Geraldine Dawson, and all the participants and families in our study.